I looked 28 last time. Now I'm 25.
Wow,
Look
3
at my
years, one treatment.
Yeah,
That's what we need to call it.
I look
A
my
3 year,
age.
one treatment.
You're live.
All right, that's actually really, really good. Hey guys, it's Dr. Emer. We're in West Hollywood, and we have a young patient here today that has some scarring. You can't really appreciate it that much because he has some numbing cream on here that now has swelled the tissue. We also are putting in some nerve blocks for a stronger treatment that we're going to do today, both a combination of an ablative and a non-ablative resurfacing. He's going to get basically the ultimate treatment for acne scars, which is going to be the combination of dual wavelength laser plus deep lasering at the same time for all of his scarring. It's going to be a really good treatment, but the most important thing is patient comfort. And what we're going to do today is do nerve blocks on him, which we've already done primarily in his upper and lower faces. Now we're going to his mid face. We're going through the mouth. I always tell people this is like going to the dentist a little bit. One of the people I had that taught me is a maxillofacial surgeon, and he taught me all these nerve blocks when I was a resident. So when I first started doing this, all my lasers, we did nerve blocks, and it really made it a big difference for people in terms of how they felt during the laser treatments. Good.
Did he do anything to pre-treat?
He did, actually. We were just talking about that. So I can't tell you his age. I want you guys to guess. But the Vizia machine said he was 3 years older 2 weeks ago before he did his Cosmetic peel. And what's your ethnicity? What's your background?
Latino.
His Latino background, so there's a risk of hyperpigmentation when you're doing strong energy-based treatments. So we pre-treated him with a peel that has a lot of hydroquinone, retinol, vitamin C, ascorbic acid, and azelaic acid. Perfect. You're going to feel one other pinch here with your chin. Little pinch, 1, 2, 3. And now we're getting him ready for a strong treatment. And he'll document this over the next week to 10 days. We want to get him the best improvement that we can. So we're going to be using a combination of a couple devices. And one of the devices is the Cyton Halo that we're going to use, and it's going to be great because we're going to have a dual wavelength treatment. And then we're also going to do some deep, I'm going to do a little pinch by your mouth. 1, 2, 3, bear with me. We're going to do a deep CO2 to all of his individual scars on his cheek and his temples. So we're just doing our little nerve blocks around the mouth. It's not the best feeling in the world, but he's doing great. Shorts. Short. We're almost there. We've done the middle, we've done the lower, we've done the upper. Now we're going to do a jawline and his nose, and then he'll be ready to go in about 10 minutes. Need a bunch more.
How long will he be numb for?
Numb for about 2 to 3 hours. But he's going to feel, and the reason this nerve blocks actually helps after the lasers is because the lasers give you like this sunburn feel. And this allows us to decrease that feel over the next few hours, making it much more tolerable. Because all these laser treatments do hurt. And I always say that the men, always it hurts a little bit more than the women, because I think the women are just used to doing these things. Turn all the way to the left. And you're going to, a little bit more, a little bit more. I'm going to do some pinches along the hairline here. And there's different ways to do numbing. This will burn a little bit, so take deep breaths from me. We're just doing local injections and the central nerves, including the zygomatical temporal facial nerve, which is over by the eye. And that helps give a little bit of numbing to the lateral part of the midface. You could do tumescent anesthesia, which is where we inject a lot of fluid in the face like we do for Renuvion treatment, but then the person looks like an elephant for 5 days. So we try and limit it the best we can with doing these local injections like we're doing. And he's almost there. The one thing I always tell people, so there's a little bit of epinephrine in some of this, so sometimes your heart rate will go up a little bit, but that's why we give some medicine to calm it down.
Will he be able to drive later on?
No. We do not want him to drive if we're giving him pills and shots. Turn all the way to the right. Not a smart idea. These procedures, it's better to come with somebody so that you can get pampered on your way home. You should be given ice cream and, you know, a nice derby hat. You're ready to go in the car or wherever you're going to go. I have had patients try to shop on Rodeo, not my suggestion, but they do.
The office should have a Uber discount code.
Is that an Uber employee? Can you get that for me or no? I would
Try
be
our
fine with
best.
that. No, eventually I want to have a car. We'll take people where they want to go. It'll be a Jason Emer car, not an Uber car.
Emer.
Yeah, the Emer mobile. That'll be fun. All right, we're almost there. Little pinches along the jaw. Reason we inject this area, you guys, is there's no major nerve here. So you can't really numb this area well. Okay, last couple. You're gonna feel a few pinches on your nose. Keep your eyes closed. 1, 2, 3. Dorsal nasal nerve.
How long does this swelling last?
This will be gone within a few minutes, actually. All right, last one. Sorry, deep breath, deep breath, deep breath. Okay, all done, all done. We're gonna put more numbing on him, let him sit for 10 minutes, and then we're gonna start.